Hello, my name is Thomas Groth-Wassing and I'm a general surgical consultant at Ipswich Hospital. Patients often ask me what they can do to help with their recovery after an operation. This video is based on advice given by the medical team at Boston Medical Center in the US. They have shown a reduction in the number of lung-related complications following surgery with a list of simple measures. It is important that you follow the advice of your doctors, nurses and physiotherapists on the ward and the advice given in this video.
Hello, my name is Ruth. I'm the sister in the preoperative assessment unit. Preparing for an operation is an important time. You will attend a preoperative assessment to help us gather information about you and to assess your fitness for your operation. Exercising your heart and lungs by increasing your exercise tolerance is really helpful. Purposeful walks, swimming and cycling may be examples of this. Reducing alcohol consumption and smoking cessation are important and we can give you advice and help with this. Drinking plenty of water and eating an iron-rich, high-protein diet can help in many ways, and we have some leaflets which can advise about good food choices. It is also important to ensure good oral hygiene preoperatively. Preoperative preparation is about you and us working together to help you get better.
ICough is a prompt to remind you of the simple measures that are important for good lung function and a speedy recovery after an operation. I stands for inspiration. It is important that you're able to take 3 deep breaths in and out, 3 to 4 times every hour following your operation. If your pain is not well controlled, you may find that your breathing becomes shallower and it is difficult to take a deep breath in. This can lead to developing a chest infection, but please let your nurse know if you have pain for this reason. C is for coughing. After surgery, it is important that you are able to have a strong cough. Coughing may be uncomfortable, so please speak up and let your surgeons and nurses know if you need more pain medication. It can also help to hold a pillow or a towel on your tummy while you cough. Again, please let us know if you do not have a pillow or a towel or if your pain is not well controlled. O is for oral or mouth care. It is important that you brush your teeth and use mouthwash at least twice a day, before and after surgery, even if you are not eating. This will help and decrease the amount of mouth germs that could cause infection in your lungs.
U is for understanding your pain. We understand your pain is unique to you. Good pain relief is important for your general well-being and recovery. Before you go to theatre, you will see the doctor responsible for looking after you during your operation and managing your pain. Together, you will decide a plan for your pain relief following your surgery. After your operation, the doctors and nurses will ask you about your pain and can alter your pain relief as your needs change. You can help us by telling us how you feel. If you experience pain that stops you from deep breathing or mobilizing, you must tell the doctors and nurses looking after you so we can improve your pain management. If we need to, we can call our pain team to come and see you, and we encourage you to ask the nursing staff to call them too, including between drug rounds if you feel necessary. Remember, we are all here to help you and manage your pain. Good pain relief regularly will lead to a quicker recovery.
G is for getting out of bed and walking. Sitting out in your chair and walking up and down the corridors and wards is a really important part of your post-operative care and recovery. We encourage you to sit on the edge of the bed and then in a chair on the day of your operation. On the day after surgery, we would encourage you to sit out in the chair at meal times, even if you're not allowed to eat. You may also not be steady on your feet after your operation, so please make sure to ask for help from our ward staff until we are happy you are safe that you can mobilise with family and friends or independently. Patients often find that this is easier following a dose of pain medication and often find that their pain and discomfort improves with sitting out and mobilising. Please ask for your medication before you mobilise and as you require, rather than limiting pain relief exclusively to regular drug rounds. H is for head of the bed being raised. We hope that you're out of bed as much as possible. However, When you are resting in your hospital bed or sleeping, it is best to have the head of the bed elevated at approximately 30 degrees. This will help with expanding your lungs. It is also important that you continue to carry out the exercises that you were given in the preoperative assessment. These include pumping your calves, wearing your hospital stockings, in hospital and at home, and having regular injections directed by your surgical team to reduce the risk of you developing a blood clot.
We hope this video has helped you to understand how we can work together to get you better more quickly. If there's anything we can do to make your stay more comfortable, please don't hesitate to contact your surgical team. We thank you for trusting us to care for you and accept this responsibility sincerely. We wish you a safe and speedy recovery.